Okay. All right, I'll just go ahead with a quick introduction. My name is Lori Christenson, and I am the newly appointed health officer for the Gallatin City County Health Department. So I'm going to go ahead and start with a quick sharing of our most recent surveillance report, and then I'll open it up for questions. So we're going to hopefully share a screen. Okay, so can everybody see the surveillance report okay?
Yep.
Thank you, I appreciate that. So we're gonna go ahead and start with just a general overall really good picture, really good news. It's very similar to last week. We are trending in the right direction in terms of the number of our daily 7-day average of COVID-19 cases per 100,000. It's pretty level with where we were last year, or excuse me, last week, not with where we were last year. So again, we're moving in the right direction, and I'm really happy to see this. And anticipate, especially as individuals continue to get vaccinated, that we'll hopefully see this stay at this level. Again, this is good news in terms of our percent positive. Just as a reminder, we are trying to avoid this higher red line here, which is our 10% positivity rate. Where we have been in the last few weeks here now is really below that, even that 5% test positivity rate. And just as a reminder, as you hit closer to that 10% mark, or this red line here, that means that there's potential for disease that we may be missing. So this is also really good news. I'm going to go ahead and skip to our number of days for specimen collection. Again, earlier on, as you know, we were really struggling to get those laboratory test results back just because of the volume and just the demand on the system. And we really have seen a good positive return on getting those back in a timely way. And the same with our contact tracing efforts. Our team remains able to, in a very timely way, investigate cases and address any quarantine needs as well. So again, this is really good news. Not much different to share as it regards to cases by age group. Again, we still continue to see, the younger age group, still trending in that direction with the higher cases. Although you can see that there is a nice leveling of that curve, which is what we like to see as well. We really only have, as of right now, one active case in local school. Obviously schools are out for the summer break. So certainly, we won't be seeing as much activity as it relates to some of our schools. I'm going to stop sharing this and share something else with you as well. That I'm not sure we've shared this with you in the past, but this is information we receive from the state every week. And this is basically a snapshot for the entire state, as well as kind of gets more specific to Gallatin County in terms of our vaccine administration. So here you can see, and this is Montana in terms of the number of individuals who have been fully vaccinated. It looks like we're hovering right around 40% for Montana. And we move to the left here, you can see Gallatin County. This is really good news. We are one of the top counties performing in the state in terms of percent eligible getting fully vaccinated. We're right below 50%. So just kind of right on the edge there. So I wanted to share that with you, and then wanted to also just share with you uptake by kind of age groups here. So in terms of some of the efforts that we may be focusing on and moving forward, are looking at these data and identifying opportunities to help increase the percent, at least with one dose of vaccine. This is just one dose of vaccine. I should reiterate that this is not fully vaccinated. This is just with one dose. And as you can see, some of the younger age groups, there's some room for improvement there in terms of getting one dose, at least one dose of vaccine in these eligible population groups. So I wanted to share that with you as well. Overall, I also just want to point out that, you know, we have 60% of our eligible individuals here in Gallatin County who've received at least one dose. That's tremendous. You may have heard on the national news or elsewhere that, you know, a good goal to target is 70% with at least one dose. So here, when we were sitting here at 60%, that is great news. And it means we have more work to do. So with that, I will stop sharing my screen and open it up for questions from all of you.
Hey, Lori, this is Nora Shelley with the Chronicle. How are you doing?
Good. How are you, Nora?
Good, thanks. I had a few more vaccine questions. I guess I'm wondering, first of all, like what, can you talk about like the clinics the county's running and what kind of strategy is at the moment for the county when it comes to the rollout?
Yeah, thank you for that question. So the question is, what are the strategies for the county in terms of additional vaccine rollout moving forward? So this week we held one of our last scheduled, what we call points of dispensing, or a pod, at our Gallatin City County Fairgrounds. And we realized that at this point in time, when I was mentioning that 60%, we are likely to have addressed those who were eager to get a vaccine, and even some of those who may have been on the fence. So at this point, we're really focusing our efforts on addressing vaccine hesitancy, as well as making the choice to vaccinate the easy choice. And so what that means is making the vaccine easy and accessible to members of our community. So we've shifted a lot of our focus and our effort to offering more mobile type operations with a local provider that we've contracted with, so that vaccine can be available to places such as at community gatherings or social events like farmers markets and libraries, and along traffic corridors such as at a gas station. And these at these mobile locations, we're hoping to offer both Janssen, so that Johnson & Johnson vaccine, as well as Pfizer, to provide people with some options. Another effort that we're looking at, and we've been working on as well, is working with some of our local businesses to offer these clinics in on-site clinics in their establishments as well. And again, our goal here is to really try and meet people where they're at, to make it easy and accessible. And that's going to be really important moving forward.
Okay, gotcha. Thank you. And I was also wondering about you mentioned like businesses. So are you working with like employers for their own employees, or is it just kind of hosting it at local businesses for whoever shows up?
Yeah, that's a great question. So the locations that we're talking about for businesses, I'll give you an example. We recently held one at Wrestler Motors. That was obviously, it was open for Wrestler employees and their families, but also open for individuals to schedule an appointment or as a walk-in. So that's an example of a location to really try and target, the employees and their families and the community. Other places that we're looking at are, the town pumps. And again, those are open for our employees as well as community members who are in the area as well.
Okay, gotcha. And the last thing I'll ask is, does the county have any sort of timeline in mind for how long you'll kind of stick with the strategy, or like, would you like to get to X% by X date, or is there any sort of dates, I guess, like that?
Yeah, that's a great question. So the question is if we have a kind of a target or a strategy moving forward. We do. We are working with our incident management team to really take a close look at all of these available data and identify, targets for specific age groups, as well as, what it looks like when we know when Pfizer, for example, is authorized for younger age groups. Those targets are going to move. And so we're going to continually reassess and reevaluate where we can be to have the biggest impact, and identify some really specific strategies so that we can continue to increase that vaccination rate, edging closer and closer, we hope, to getting at least 70% with one dose here in Gallatin County.
Okay, thank you.
Yeah, thank you. Other questions?
Yeah, hi Lori, my name's Holly Michaels and I'm a reporter with Lee Newspapers. I've got 2 questions for you. One, I've been looking at new CDC data, and then there was a state health department report that came out a couple months ago showing that for the first time ever, Montana last year, deaths exceeded births. And it talks about COVID playing a large role in that, but it doesn't fully account for what we saw. And there's increases in deaths from years past from things like diabetes. And I'm wondering if from a local public health perspective, you would have any thoughts on that increase in deaths, and wondering with that population that COVID isn't listed as the cause of death, that they have underlying conditions, if there's any connection with maybe a possibility of underreported COVID deaths there where it was maybe not detected at the time, or if it was people delaying care in that period where they couldn't access hospitals or doctors as easily. Just wondering if you had any thoughts there from your perspective.
Yeah, so I'm sorry, I had a little bit of a hard time hearing you earlier, the first part of your question. So I'm going to shoot it back to you and see if I'm going to, I want to make sure I'm going to answer it correctly. So your question, no, it's okay. I adjusted my volume. That was helpful. So if their question was, I have not read the report, but so the question was, from a local perspective, do we believe that COVID case numbers have been underreported? Is that the question?
So there's I've been reading a lot about this. And there's kind of 2 thoughts with it, that, deaths were up. COVID deaths were obviously a large part of that, 3rd leading cause of death in Montana last year. But then other things were, like diabetes, hypertension, those deaths also increased pretty dramatically. And, some people are saying that could be because maybe COVID played a role in those deaths, but it wasn't tracked. So maybe the overall COVID death numbers are a little off. Or it could be those are people who need to access care a lot, but they weren't able to during the pandemic. And just wondering from your role, if you've got any perspective on that.
Yeah, thank you. I appreciate you repeating that for me. So I haven't read the specific article that you're mentioning, nor have I kind of looked deeply into the deaths, the death rate versus, birth rate for Gallatin County specifically, outside of COVID or definitely related to COVID. We've been tracking that. I think one thing that I would say, and I know that for a fact, chronic disease is a huge and has been a huge driver of health in our community. So it's reasonable to believe that there is a connection if individuals were not able to be as active as they were, or weren't able to access care as well as they had before, or prolonged care or treatment, such as related to their management of their chronic disease, that there could be a correlation there. I hesitate to jump at that conclusion without looking more deeply into it, and I'd be interested in doing so and following back up with you at some later date. I don't have a lot of insight other than what we generally know about chronic disease is, there are lots of ways to reduce risk and increase quality of life with chronic disease. So if there was a decline during the pandemic of healthy behaviors or choosing healthy behaviors, such as being physically active or diet.
Did we lose her, or was that just me?
I can still hear you, Lori.
Okay.
Yeah.
Sorry, Cody, can you still hear me? I'm going to keep going and hope that Cody can pick up our sound again. As I was saying, just with related to, if there was a decrease in physical activity or a change in diet, or an increase in tobacco use or other substances, that could have driven potentially the rise in chronic disease. I hope that helps answer your question.
Yeah. And then just the one other question I had, and understand if you can't speak to this, as well too. I'm wondering though, in terms of what you're talking about with the rollout of the vaccine, what sort of effect I don't know if there's any you've seen in Gallatin County to date, and understanding that is still pretty fresh with vaccine rollout, or looking forward, what that you would expect to do for the death rate from COVID specifically.
Yeah, so I would hope, and what we've seen nationally and even statewide and locally, is that with an increase of vaccine rate and availability, we'll continue to see the death rate decline. That's one of the main drivers of and the importance of getting this vaccine, is because it does reduce the potential for serious illness and death.
Awesome, thank you.
You're welcome. Thanks for the question, Holly. Any other questions?
If no one else had any more, I have a follow-up if you don't mind.
Sure, go ahead, Nora.
Yeah, sure. I didn't write down the numbers, so I don't have it exact, but the 18, I think it was 18 to 29 age group in that chart you showed, I think they were on the lower end. And I guess I'm just wondering why you think that is, and kind of if there's any sort of targeted strategy for that, the people in, their 20s and late teens.
Yeah, so great question. So the question was related to the number of those vaccinated, at least fully or with their first dose, and kind of that 18 to 29 to 18 to younger range. We'll just call it that for simplicity. So that's one of the things that our team, now that we have a little bit more time to focus on really talking about the educational strategy and the prevention strategy with our case numbers lower, that's one of our main priorities, is trying to identify, identify some targets around trying to increase that number of those with one dose in those age groups. One of the things could be related to, concerns, just as anyone does, concerns about maybe, the pain associated with a vaccine, potentially even the accessibility of that vaccine for that age group. So those will be we're going to continue to dive into those data and identify some targeted strategies in the weeks to come.
Okay, thank you.
Yep, thank you. Any other questions? All right. Well, seeing none, again, I really appreciate you guys joining us today, and feel free to reach out if you have other follow-up questions, and we'll look forward to doing more of these in the future. But otherwise, everyone have a good rest of your day.